I'll have to be admitting people as we go here. And I'll start now. Welcome everybody to Wednesday Night at the Lab. I'm Tom Zinnan. I work here at the UW-Madison Biotechnology Center. I also work for the Division of Extension, Wisconsin 4-H. And on behalf of those folks and our other co-organizers, Wisconsin Alumni Association, PBS Wisconsin, and the UW-Madison Science Alliance, thanks again for coming to Wednesday Night at the Lab. We do this every Wednesday night, 50 times a year. Tonight, I was hoping to be able to introduce to you Christina Carlson, but she had to postpone early this afternoon, and I'm looking forward to rescheduling her at a later date of convenience to her sometime soon, I hope, because I'm looking forward to hearing what she has to say. I'm also very grateful to Pat Remington, who put me in touch with tonight's speaker, Jonathan Patz, who very graciously agreed to give a talk 2.5 to 3 hours notice. And that's why I'm not giving myself CPR right now. Jonathan, I'm going to ask you the standard 5 questions that I ask everybody. Where were you born?
I was born in Baltimore, Maryland.
And where'd you go to high school?
At Friends School in Baltimore.
And then where'd you go for your undergrad and what did you study?
Colorado College in Colorado Springs, and I was a biology major.
And then where'd you go for your advanced degrees and what are they in?
Right. So I went to medical school at Case Western Reserve University. So that's where I got my MD, and I got my Master's of Public Health at Johns Hopkins Bloomberg School of Public Health. And I have medical boards in family medicine from the Medical University of South Carolina, and also medical boards in occupational environmental medicine from Johns Hopkins University.
And when did you come to UW-Madison?
I came here a glorious 17 years ago, and it was a great, great move.
Very good. It's great to have you here. I really appreciate you, again, being able to do this at such short notice. My thanks again to Pat Remington for having dinner with you last night so that he could let you know this might be happening. And tonight you're going to talk with us about building back better from COVID-19 and the global climate crisis. I hope everybody will join me in welcoming Jonathan Patz back to Wednesday Night at the Lab.
Thank you, Tom. It's a pleasure to be here. And I'd like to just dive right into this topic about how can we build back better from the pandemic and from the climate crisis. So let's start from the beginning. The pandemic, the roots of the pandemic really go back to how we are treating our natural ecosystems. When you think about the main reservoir host of COVID, these are bats. And I'll show you a couple of examples where we know that disrupting bat habitat has led to disease emergence. So we think that there's some relationships at the front end of the pandemic related to environmental destruction of our ecosystems and the climate. And when you think about ecological disruption and disease emergence, I couldn't resist this image from an op-ed, what the coronavirus pandemic tells us about our relationship with the natural world, because what we know about what is called zoonotic disease spillover, and I'm going to sort of unpack that term in a second, but a zoonotic disease is a disease that naturally occurs in wildlife. And when you have what's called zoonotic spillover, that means a disease moving from its natural reservoir host in an animal, spilling over into a human. And if you look at this column on the left side, these moving tiles, it's very rare that they line up and you get this blue bolt of lightning striking. And that blue bolt indicates a spillover event. They're rare, but when things align, they happen. And let's start from the beginning. These animals that carry diseases, depending on where they're distributed and how densely they are together, determines the initial risk of having a pathogen in the environment. So let's say you cut down a forest and you force bats to move to be more concentrated, or another animal reservoir carrying a disease. There may be more transmission amongst those individuals as you increase their density. And so you get more of the pathogen. And if humans come into contact, let's say from deforesting or bushmeat hunting or going into an unnatural place for humans in the wild, intruding into natural ecosystems, then you can have that species, the pathogen, jumping over into a human. And this is called a spillover event. This happened in Australia. It was a peculiar emergence of something called Hendra virus. It's a bat-borne virus that was infecting horses in Australia. And from the horses, owners were getting sick as well from the aerosolized virus. And they couldn't figure out what was behind this new outbreak. Well, Dr. Raina Plowright put this story together where she realized that there were bats, fruit bats, that were in horse paddocks and in parks in Australia that were not there before. And looking back at extensive analysis that she did on land use change, realized, and also radio tagging bats to see where they migrate. Usually these bats overwinter in Indonesia and Borneo, but because of massive deforestation in Indonesia and Borneo and also Northern Australia, these bats had no winter food, winter resources to survive on, and they were forced to migrate. So here is a classic story of destroying nature, forcing those bats to change their behavior and their migration, and ending up in a place where they don't usually occur, leading to a disease outbreak. And we think that there's a very likely situation with COVID-19, bat-borne virus. Of course, there's the intermediate issues about the Chinese wet markets and international trade and travel. But many of us think that the original domino to fall is the destruction of natural ecosystems, which were forcing these bats to move. And as we recognize these links between nature and diseases, when we see things like this deforestation in Brazil, and you can see the red bar showing a new rate of deforestation, I can't help but ask at what risk, because we do understand links between the natural world and human diseases. We've done studies in the Amazon linking deforestation to the rise of malaria as just another example. So when you look at the emergence of COVID, and you recognize that intact nature can be prevention as far as the emerging diseases, it's really important to shift our focus to, if we're talking about pandemic preparedness and prevention, we really need to be looking upstream at causal factors. And we recently, with Dr. Plowright, published this piece about land use induced spillover, a call to action to safeguard the environment, environmental, animal, and human health. And another related paper, and it's trying to prevent spillover of these zoonotic diseases, is in actions to protect in protected and conserved areas. So where we have natural ecosystems, conservation becomes a health intervention. So it's something that we really need to consider if we want to build back better for preventing the next pandemic. We need, of course, to have improved surveillance and detection and find emerging viruses when they first occur. But if we can go further upstream and understand the ecological disruptors that may be the first domino that triggers this cascade of events to an emergence of a new disease, we really need to be thinking about nature, preserving nature and conservation as part of our public health strategy. Now, the other aspect of environmental change, it's not just land use change, but of course, climate is changing and climate's changing rapidly. This paper came out a few months ago showing that there was a shift in bat biodiversity that may have been related to climate change, regional climate change. So anything that you do for environmental disruption, climate is, of course, is one other part of the environment. And these authors showed that in the region, the climate was so much warmer and there have been changes over time that would have impacted those bat species that carry coronavirus. So this paper, even though it's hypothesis generating rather than proving that climate change caused the emergence of COVID-19, it still is an interesting association that is worth following up because this could have been one of the contributing factors. And climate change has been on all of our minds. Of course, we need to call it the climate crisis. We can't call it climate change anymore. Look at last month, the world's hottest month on record. So if we're thinking about preventing the next pandemic, we also need to be thinking about other global health emergencies. And do we have lessons learned from the pandemic when we think about this other global crisis, which is climate change? And you can see here, this is a scenario of what the temperatures are going to look like in the United States between 2040 and 2060, extreme temperatures. And you can see that places like in Phoenix, they'll see 6 months that are above 95 degrees. And so this is what our future is going to be looking like. And if, this is looking at models, but let's take a look at actual measured temperatures. It's not your imagination that summers are getting hotter. This is measured ground temperature in the Northern Hemisphere. This is data from the famous climate scientist, Jim Hansen. And this bell curve of temperatures shows you summertime temperatures from 1951 to 1980, 83 to 93, 94 to 2004, 2005 to 2015. So it really is getting hotter. And my question is, when we think about climate change and these physical attributes of warmer temperatures, sea level rise from thermal expansion of salt water, and extremes of the water cycle, hydrologic extremes, more droughts, floods, and fires, all of those physical attributes have a huge impact on our public health. And in the green box, you see the many different exposure pathways through which climate affects us. And I'll go through some of these, but it's why I have picked this topic as my career, because I view this as the most serious environmental public health challenge of our times. And each one of these pathways has climate sensitive outcomes. And we'll talk about a few of these examples. Of course, we know that people die in heat waves. The European heat wave in 2003 killed upwards of 70,000 people in about 11 days. That is an absolute public health disaster. I'm going to show you a couple images from this summer, because I'm sure you're all aware of the major heat dome that that hit our country. And here you see a graph of, temperature goes up and you see this spike in mortality right after the heat wave. Last year, we had problems with fires. Fire smoke is dangerous. There's some new studies showing that it's more dangerous than emissions from vehicles. I saw a study last month from the Journal of Pediatrics showing that wildfire smoke is 10 times more hazardous that compared to other forms of fine particulate that harms children. So not a trivial problem. And this is something we all know from this just last month, at the end of June and into July, we had this heat dome effect. And you saw record-breaking temperatures throughout the Northwest. There's a weather attribution initiative happening, and they ran the numbers on this event. And this heat dome event was virtually impossible without climate change, human-induced greenhouse gases in the environment, disrupting the Earth's climate. The extreme level of this heat dome and the intensity of this heat would not have happened according to this new, this is a new weather attribution initiative where we can begin to say, hey, that's a severe event. How much of it was attributed to climate change versus just a random event? And this event would not have happened without climate change. And of course, we saw wildfires following those heat waves. There were a few hundred people died in that heat wave. An agricultural worker died in the heat wave. But of course, we also have forest fires erupting. And how many of you remember the orange sun and the orange moon many times this summer in Wisconsin? This is showing where the smoke ends up. So Minnesota and Wisconsin, we get a lot of this smoke from the wildfires. Of course, there are other issues with record-breaking temperatures. This is a map from looking at NOAA probability, the National Oceanic and Atmospheric Administration, showing probability of places that will have record-breaking summer temperatures. The top map is mid-century. The bottom map is by the end of the century, everything in red will have a 90% probability or greater of having a record hot temperature. And that's a problem, especially in the tropics where, food crops will be devastated. It's estimated that today's 840 million people at risk of hunger, that number could double by the end of the century, or by mid-century, actually. This is a public health disaster. So I have some good news for you, though, because if any of you like poison ivy and ragweed, those are plant species that will benefit. So food crops will be in trouble and will have food crises, but poison ivy and ragweed pollen will do just fine with more CO2 and warmer temperatures. And this is a study that Wisconsin took part of, published in the Proceedings of the National Academy of Sciences, showing places, especially at higher latitudes, where the ragweed pollen season is actually lengthening. Wisconsin, our ragweed pollen season is lengthened almost 2 weeks, 13 days longer. And in Wisconsin, we're experiencing this increase in CO2 in the atmosphere. Wisconsin has warmed about 1 degree Fahrenheit since the 1950s. So another issue, another problem, especially for asthmatics. But remember that climate change is not just about warming. It's also extremes of the water cycle, more droughts and more floods. Flooding in the Midwest is going to be a major problem. You can see this dark green with hash marks, which means statistically significant increases in heavy precipitation, percent of change in spring precipitation. Wisconsin has seen 7 inches more rainfall, annual rainfall, compared to 50 years beginning 1950. So this is a problem. The other extreme, which is hydrologic extremes, and we're going to be seeing more flooding as we already are in Wisconsin. And we did a study for the Chicago River Basin, looking at, what that extreme rainfall means for risk of combined sewage overflows and contamination of our water. The projections are that by mid-century, because of very heavy rainfall, we're going to see an increased risk to our drinking water supplies. But when floods happen, in the emergency room, we don't really see people coming in with diarrheal disease. That's not what we see mostly. It's something entirely different. This is a picture after a flood, and someone, going back into their place very well. This person must be a government official going in with proper protection. But imagine if that was your basement and you didn't have that kind of protective equipment. And most people would not do that. They'd come in, maybe they would wear a mask, maybe, hopefully. But, this is a huge problem after flooding. And this feeds also into the question of equity, because, a racist past in our country and a flooded future, formerly redlined areas have seen, $100 billion worth of homes faced with a high risk of flooding, 25% more than non-redlined areas. So this is also an equity challenge. People living in floodplains, also in urban heat islands, the urban heat island effects, more impoverished neighborhoods. So this is an equity challenge as well. Shifting gears, insects are especially sensitive to small changes in weather. This is Aedes aegypti mosquito that carries yellow fever, dengue fever, and Zika virus. And Zika did not emerge until, the winter of 2015. And when I asked my colleagues over in the Nelson Institute Center for Climatic Research, Dan Weimont, who's a climate scientist there, I asked him to run some numbers on that El Nino event. And he ran numbers and constructed a 60-year average temperature, and then looked at what El Nino temperatures were bringing that year. That was our strongest El Nino in recorded history. And during that El Nino event, temperatures were more than 2 standard deviations warmer than his constructed average. So really hot temperatures. Well, the ability of that mosquito, Aedes aegypti, to carry these viruses is called vectorial capacity. The mosquito is the vector. What is its capacity to transmit these viruses? And as it turns out, that winter, because of the extremely hot temperatures, and considering that, a mosquito is a cold-blooded insect, and whatever the air temperature is, that's its body temperature, it's not surprising that these unusually hot temperatures led to the ability of that mosquito to be much more infectious. And so we think that the climate extremes driven by that very extreme El Nino may have played a factor in Zika virus emergence. Now, any disease is complicated. International travel was likely involved. People speculate that either the World Cup or canoe races that brought racers from Polynesia to Brazil to compete, there were Zika outbreaks in the Pacific Islands. Maybe that's how this virus got to South and Central America. But why did it erupt? And we think that the temperature had a lot to do with it. And for a while, I told people, you know, it's the same mosquito that carries dengue. And Zika is in the same virus family as dengue. So whatever you see with dengue fever, you're going to see the same thing with Zika. But I might be wrong, because some scientists looked at lab studies and they found that Zika virus, the transmission for Zika, is actually the optimal temperature is 5 degrees centigrade warmer than the optimal temperature for transmission of dengue fever. So now we think, you know, Zika emergence and how it exploded in South and Central America, we really wonder if that El Nino was a significant trigger that enabled Zika to erupt. Not saying that it was the only factor, but you know, it probably promoted the Zika really taking hold. So that's the bad news. But of course, I do have some good news, because when we think about the climate crisis and what it will take to fight and stop climate change from you know, completely destroying our civilization, you know, if you look at the health perspective, climate actions could actually be free or a net benefit. And I've been publishing on this. I think Tom caught me a couple of years ago, and I've talked about this a little bit before, how climate change is a challenge, but there are opportunities for global health. And solving the global climate crisis could be the greatest health opportunity of our times, and that a low carbon future could improve global health and achieve economic benefits. When you look at the main sources of greenhouse gas emissions, if you take these 3 big sectors to the right of the dotted line, the electricity sector, food system and land use change, and transportation, those 3 sectors, if we can get to a low carbon economy, there could be enormous health benefits. For example, if we look at the energy sector, air pollution from burning fossil fuels also, it not only releases greenhouse gases that heat the planet, but it releases dangerous pollutants that harm our health. We know air pollution kills people and is harmful. There are new estimates now that look at likely, you know, between 7 to 9 million people die every year prematurely because of air pollution. That's a huge public health burden. What about the food sector? How we, you know, the food that we are eating, especially if it's an energy intensive diet that includes processed grains and red meat, you know, hard on the environment and not so good for our cardiovascular systems. And so, according to this Lancet Commission report that I'm going to show in just a second, if we were to get to what's called the universal healthy reference diet, which is very little meat and more plant-based, you know, we would save 11 million lives every year. And the third sector, the transportation sector, because of the private automobile, we now have, you know, we're trending to a sedentary lifestyle. The World Health Organization estimates that because of physical inactivity, almost 4 million people die prematurely every year. So if you add up those numbers across those 3 sectors, that's about half of all premature deaths every year. So it's incredible how beneficial this could be if we could clean up our energy system, you know, get to a healthier diet and move towards sustainable, more active travel. It's unbelievable what a health benefit this could be. And going back to COVID, you know, I mentioned how ecosystem destruction is at the front end of zoonotic spillover that is likely the beginning of the COVID-19 pandemic. But also, air pollution is affecting the back end of COVID-19 mortality. A study out of Harvard University compared the top map, which is fine particulate pollution, PM 2.5 pollution, versus the bottom map, which is deaths from COVID, controlling for income and education and a lot of other factors, population density, controlling for all these other factors. They found that a tiny increase in pollution, just 1 microgram per cubic meter of fine particulate, PM 2.5, led to an 8% increased risk of dying from COVID. Not trivial. And during the shuttering of the global economy with the COVID lockdown, what could be any clearer than a picture like this from New Delhi, India? Before the lockdown, and then after we shuttered the global economy and stopped burning fossil fuel. It's a no-brainer. And we all know that pollution is harmful, but when you see an image like this that is so stark, and you realize how much pollution is out there in the world, we can't go back to that. We just can't go back to that. And there have been some studies that ask the question, how much did the lockdown actually save lives from reducing air pollution? And this is looking at 2 months in China, where because of the lockdown and reduction in burning fossil fuel, they estimate that 24,000 lives were saved. And in Europe, that about 2,000 lives were saved because of reduced pollution because of less burning of fossil fuel. So is it any wonder that, we have to ask this question at this time, do we really want to uncork the current fossil fuel economy? We don't want to go back to that. Can we get to a clean energy economy where everyone prospers? I think, to me, the answer is obvious. And you all know, who doesn't know Greta Thunberg, who started her school strike for climate? That's what the Swedish sign there is. She skipped out of school in August in 2018, protesting inaction on climate policy, and pretty quickly, because of her sincerity and conviction, got in front of the World Forum. Here she is meeting Pope Francis and telling the US Congress to wake up and do something, quit talking about it. And the youth movement is impressive and very important. And I am so glad that they are calling for action. Of course, we need to respond, and we really need to take it seriously and not delay. The other reason it's an emergency and their protests are absolutely grounded is because after the 2015 Paris Agreement on climate, world leaders came to the climate scientists of the Intergovernmental Panel on Climate Change, the IPCC, that I was lucky enough to serve on for 15 years. And they asked the scientists, what would it take to stabilize the Earth's climate so that we don't shoot above a dangerous level? Dangerous level has been defined as 2 degrees centigrade warming above pre-industrial levels. But can we even stay at 1.5 degrees centigrade? What would it take to not warm above that level? Well, they did the assessment, they did the analysis, and unfortunately, the answer was that to stabilize and not go above 1.5 degrees heating of the planet, we need to cut emissions almost in half, 45% by 2030. So in 9 years from now, we have to cut our emissions in half and get to net carbon zero by 2050. So this is a climate crisis. And because of the reasons I've shown you, it's also a human health emergency. But back to the benefits. Look at this map of death rates from fine particulate pollution because of coal-fired power plants in the United States. About 75,000 people die prematurely in the United States from air pollution from coal-fired power plants. Well, we are, these coal is on its way out, luckily, but it's got to happen faster. And we need to support coal mining communities in a serious way. We can't burn more coal, but we better support coal mining communities and have a just transition as we switch our energy systems. And an economic study looking at, well, what would the investment cost be to get to clean energy? So to avoid emitting 1 ton of CO2, investing in cleaner energy might cost $30. But what's the benefit? If you don't emit a ton of CO2, you also don't emit all the other air pollutants that happen when you burn fossil fuels. And that avoided fine particulate, PM 2.5, that's reduced, would lead to fewer deaths and fewer hospitalizations, such that for every ton of CO2 avoided emitting, you'd have a health benefit on average of $200. And I asked the decision makers, which number is bigger, the $30 investment or the $200 in savings? So this is something it's extremely important to convey, that we can't just focus on the cost of energy, but the cost of the end of what happens when you burn fossil fuels, and we are damaging the environment, and we're damaging our lungs. That has to be part of the cost equation. Those externalized costs that aren't in the market, we need to bring those in and talk about the cost, because this is an enormous benefit. But that $30 is now in question, because the price of solar has just dropped dramatically. I'm actually going to show you this one instead. Plummeting cost of solar. It's dropped 300 times, 300-fold in the last 40 years. It's so cheap, and we weren't expecting it. We were not expecting that we would have this solution this quickly and solar would be this cheap. Professor Greg Nemeth wrote a book on why solar became so cheap. This is shocking, but it's a reality. And if all subsidies were removed from all energy sources, it turns out that renewables and batteries are now the cheapest way to generate electricity. We didn't have that 10 or 5 years ago. And this is the International Renewable Energy report, the International Renewable Energy Agency. So this is, we're not waiting for miracles. We need to move fast and get off of dirty energy. I'll quickly mention the food sector and then transportation, and then wrap this up. So this is the EAT Lancet Commission report on healthy diets for sustainable food system. I'll just show a couple of images. This is a complicated slide, but the bottom line is that, everything to the right of this line, the sort of the shaded area to the right, is in excess. Like we're eating way too much red meat and starchy vegetables and dairy, and if we were to cut back on that, not eliminate it, but just cut way back on red meat, starchy, these things that we shouldn't be eating, and get to more fruits, vegetables, whole grains, and no, or at least low quantities of red meat, processed meat. If we got to this universal healthy reference diet, it would be enormously beneficial for the environment and also for our health. And if I'll just cut to the chase, the conclusion of this report, that if we adopted this universal healthy diet, we're talking about 11 million lives saved every year, and also less strain on the environment. The last sector I want to mention is transportation. because of our sedentary lifestyles and over dependence on automobiles. There are some places that are just, people are not getting exercise. And if you're lucky enough to live in a place like Madison, where our bicycle commuting rate is 6 times higher than the national average, and comparing cities with the highest rates of walking and cycling compared to places with the lower rates, we're seeing obesity and diabetes rates that are 20 and 23% lower. So this is not rocket science. We know exercise is healthy, reduces heart disease, cancer, dementia, and depression. Exercise also boosts the immune system. So if we're worried about COVID, exercise, to the right level is actually quite beneficial. So this is where we have a golden opportunity. And this is a international report that looked at the deaths from across those 3 sectors, looking at air pollution, the food sector, and transportation and physical activity. And this analysis looked at the nine countries that contribute the most to heating the planet, greenhouse gas emissions. And looking at those 9 countries, the reduction of death across those 3 sectors is just, it's just amazing, a golden opportunity. 1.6 million deaths reduced from cleaner air quality if countries met their nationally determined commitments to the Paris Agreement. That's what NDC stands for, nationally determined commitments. So if countries lived up to those agreements, we'd see major health benefits across these sectors, air, food, and transportation. So that's a lot of lives saved. In the United States, the US is pledging now for 52% reduction in carbon emissions by the year 2030. And if we followed through on this, those changes across those sectors would save 1 million Americans every year. And the health benefits would offset at least 40% of the investment costs. That's the low number, the investment costs for getting to a clean energy system. So I'll end by saying there's a role for health scientists, there are organizations, there's the Medical Students for Sustainable Future, MS4SF, Medical Society Consortium on Climate and Health. This is a national organization where mainstream medical societies, including the AMA and others, American Academy of Pediatrics, American Academy of Ophthalmology, you name it. I think there are 60 medical organizations signed up. And, it's a big, the health sector is on board to do something. And of course, the health sector is part of the problem, and we're trying to get to green hospitals. And you can see at the bottom, Green and Healthy Hospitals Initiative from the Healthcare Without Harm NGO. And there's a Global Climate and Health Alliance. The UK is pledging to get to net carbon zero. They want to get to 80% of a net carbon emissions from the hospitals, from the National Health Services in England. They want to get to that by the next 8 years and get to net carbon zero shortly thereafter. So England is taking a lead, their healthcare sector. So I'll just wrap up by, asking this question, because we are just full court press, global emergency, trillions of dollars unleashed to prevent the COVID-19 pandemic. Why don't we treat climate change like we're treating COVID-19, like an infectious disease? Because after all, climate change is a global health crisis. And I saw this cartoon a little while ago about comparing COVID-19 with a potential recession, and then climate change as a climate disaster. these things, we need to put them in perspective. So I'll end by the conclusion that in the middle of a global pandemic stemming from environmental damages and social inequity, we have the opportunity of a lifetime to seize the moment for transformative change. And with that, I thank you for your attention. You can follow me on Twitter. You can check out my TEDx. Just Google my name and TEDx. So thank you. And Tom, I'll hand this back to you, and I'll stop sharing my screen and we can open this up for questions.
Thank you very much. It's fantastic. What we're doing now for questions is if anybody would like to speak a question, they can. If somebody would like to type questions into the chat, we'll alternate, go back and forth if there's enough of each type. If anybody would like to start us off, Larry, you had a question that I asked that you might, when we were in the pre-game warm-up, if you'd like to re-ask your question and let Jonathan have a stab at it, that'd be great.
Sure. Although it didn't quite cover it, I'm not quite sure my question fits within the presentation too much, but recently there's been shown a substantial infection rate among white-tailed deer of COVID. And I guess the question is why that might be the case. It's not like we have pets. These are wild animals, and we don't have white-tailed deer as pets. So the transmission was a bit of a surprise there. How come that is actually happening, and what does that say about the COVID, the virus itself, about being able to be that widespread among wild animals?
Right. Larry, that's a great question. And I love your background of Many Glacier in Glacier National Park, where the glaciers are disappearing pretty quickly. Yeah. So no, that's a great comment and question. And of course, for this pandemic, what it emphasizes is how intertwined our health is with wildlife health. The fact of the matter is that a majority of newly emerging diseases in humans come from wildlife. And some of our established diseases like tuberculosis and measles came from domesticating animals. So it's a reminder that we really need to be looking at, wildlife health, environmental health, because they're so intertwined with human health. There are many people now looking at where this virus is ending up. They're looking at different bat species. I know Tony Goldberg has been looking at bat species in New Mexico to see, are they picking up this COVID-19? So far, I think the answer is no. But, cats, tigers and in zoos are coming down with COVID. And so the question is, how widespread are these species to species spillover events? And then what does that mean for transmission? What does, COVID showing up in deer, what does it look like? What is the virulence? How many, is it actually potentially infectious back to, say, how would we get it from deer? Well, you'd need to, well, I don't want to talk about butchering because that's a whole different process, but, it would be something like a vampire bat taking the blood of a deer, because we know that this doesn't work in mosquitoes. It's not viable in mosquitoes, but, a vampire bat happened to be infected by taking the blood of a deer that's infected and then ended, these are things that we have to think about. But I think that right now the assessments are underway. As far as I know, that's a pretty low risk. But this just makes makes us realize we need to be checking. We need to be looking across species and take the One Health approach, healthy life. Looking at wildlife health as we think about our own health. So I don't actually have the answer for you. But it's something that we need to keep monitoring.
From the chat, Dareth asks, are we able to feed another 25 million people? And I'm guessing that would be even more people over time. What's your assessment on feeding people better, more?
Right, right. Well, all along, the problem has not been how much food to produce, but a matter of distribution of food. So, we produce a lot of food, but it's the distribution problem and removing food waste too. The United States, we waste 40% of food. Globally, we waste 30% of food. So if we were to take a handle on, optimizing our food system and remove the waste, number one, that could solve the problem immediately. And number two, if we can get to better distribution of food, I think it's not that hard to feed more people. It's just a matter of getting better distribution and removing food waste.
Does anybody have a question they'd like to ask directly?
Why have we not heard of this universal healthy reference diet in the popular press in this country?
Yeah, the universal healthy reference diet is something that came out of this new report, or at least the 2019 report. And it's very similar to a Mediterranean diet. And I think that it's a good diet, but it's anywhere between the Mediterranean diet and a more plant-based diet. So it's not rocket science. It's basically saying, eat much less red meat and dairy, increase plant-based diet, and the things that we already know improve our health and are better for the environment. Those are things that I think we already know. So not knowing universal healthy reference diet, it's okay as long as you know about the Mediterranean diet and more plant-based diet. I will say that we do need to change our policies. I am not advocating being vegan, but I would say that the concentrated animal feeding operations that are mass production of meat is a problem for the safety of our water, drinking water in Wisconsin. It's a problem if we're eating too much meat. It's a problem because of all the antibiotics that are used in those concentrated feeding operations, the CAFOs, that lead to antibiotic resistant strains of bacteria. So, I think, as a policy, I am not a fan of CAFOs, and that's something I'd like to see, the health rationale and the environmental rationale come together to see what we can do to reduce those operations here in the country, but all over the world, but especially as they've moved into Wisconsin. It's not a good thing for us.
RHARR in the chat asks, saving lives is an admirable goal, but isn't human population growth also a serious intrinsic problem?
Yeah, great observation, great question. The root issues are, human population growth and per person consumption of energy, per capita energy consumption. And I would argue that through UN programs, we are making great progress in stabilizing the world's population. The world's population is growing, but we are having tremendous success in family planning. And when women understand the benefits to health by reducing family size, they're opting to that. So as countries are coming out of poverty, their family sizes are shrinking. So it's something we need to keep an eye on. And of course, population is important. But I would argue that we're having far less success in curbing per person emissions or consumption of energy. And, we're quite guilty being Americans. We use 6 times more energy than the average global citizen, and anywhere to 40 to 50 times more energy than someone in India or a poor country. So yes, population is important, but I think, where we'll get the greatest benefit is if we really focus on the per person energy emissions. That's where we really need to make the most progress, and in a hurry too.
Sandy, do you want to ask your question about activism?
That's not my question. There's two Sandy Rodders, and the one who asked that is not me.
Wow, cool. I didn't know there were two Sandy Rodders. So the other Sandy Rodder asks, how do you feel about activism, as in Extinction Rebellion, since nations are not meeting their targets?
So, I basically, I think that we really need to be active. For me, I'm a professor here, and I need to advocate the science and push forward the evidence and the rationale to act. But I know that the Wisconsin Health Professionals for Climate Action and the Medical Society Consortium on Climate Change, these are groups that are I applaud them for stepping forward. I applaud the youth movement for stepping forward. The Extinction Rebellion, if they're pushing forward, and 350.org, all of these groups, I think they have a role, because science can go so far and information can go so far. But I do think that we need to do a better job of affecting policy. And for me, I try, and in fact, the Wisconsin Health Professionals for Climate Action is a nonpartisan group with doctors and nurses and health professionals that are pushing hard to show that the climate crisis is a health emergency, and there's no politics in it. It's just saying we have to act. And that's where I think it's really important to recognize that climate change, it's not a partisan issue. It's about the survival of our civilization and about our health. And so we need policies, no matter which side of the aisle they're coming from. We need policies quickly to get to a low carbon economy. And so we need every voice that we can get out there to be pushing, to be promoting the information, and to understand that we have a 9-year window to really get serious and turn these emissions around and get to a sustainable planet that will, the planet doesn't care, to be honest. It's about us, our survival, but our survival depends on planetary conditions and a stable climate.
Raj asks, have you studied the impact on population migration among the various states in the United States due to climate change?
Great question. I'll refer, I don't know about US state migration, but I'll talk about international. Right before the Syrian civil war, they experienced the worst drought in their instrumental record. And the rural to urban migration rate was 4 to 5 times higher than normal. Farmers were leaving, heading for the cities. And there were food price shocks. There were riots in the street. It's hard to prove that extreme drought caused the Syrian civil war, but we've seen other places in arid countries similar to this, where you see extreme conditions and rioting and problems. So to be honest, I personally think that the environmental refugees from extreme climate disasters could become the iceberg under the tip of the iceberg. That forced population migration could be the largest threat from the climate crisis around the world. So a hugely important issue, extremely difficult to tease out the climate effects versus the political instability and they're interrelated, very hard to prove. But when I look at those associations, I'm very concerned. And I know, of course, our Defense Department is extremely concerned, and our US Defense Department views the climate crisis as an emergency.
Raj, I'd chime in here based on, I spent the first week of August and last week of August in California. And one of the things both of them were in Eastern California where a lot of the fires are. One week was up in Truckee, the other down in south of Palm Desert. The migration that strikes me is the potential of going from cities to rural, triggered in part by COVID and also fed by the whole high-speed internet stuff. As a personal observation, the Airbnb that we rented for 5 days in Truckee had internet at 650 megabytes per second. And where I am 3 blocks south of Camp Randall, the best I can get is 50 or 60. So the irony is in Syria, the crisis pushed rural people urban. There's also the possibility of pushing urban people rural. And that turns around and bites you in the rear end because you have a lot more houses out in the forests and countrysides, and that's what's burning. That's what's causing some of the issue with the fires. It's not just the forest burning, it's all the houses and dwellings and companies that are burning with these forest fires. So that's not a question, it's an observation, but I think it's going to be very interesting to see the kind of bungee cord effect that we get.
Yeah, and then the other lesson from COVID is here we are on Zoom, and I have a feeling that people are going to be traveling less to international meetings and will be Zooming. And of course, I think workers heading to offices, I think there's going to be a reduction there. So there's something, where infrastructure, building back better means building really good internet capacity, as well as being equitable, making sure that students that were not able to have internet, that if you're disadvantaged and you don't have internet and you can't learn remotely, that's a problem. So that's part of the infrastructure package. I think it's good to see the internet.
One of the other images that struck me was the number of times driving across Oklahoma and Kansas where you could see 3 or 4 different energy sources, natural gas, the pumping of oil, solar panels, and wind generating electric, well, what do you call wind generators? Windmills. That's a very different look to the countryside than I remember 50 years ago driving, first time I drove across the Great Plains of the United States. And to me, that gets at the issue of how do we generate jobs as well as electricity as part of solving and resolving these issues of climate crisis, global health, public health. So thanks for letting me tune in on or chime in on that also.
Now I see a question from Sandy Rotter about the built environment, which is really important. And I think that as I mentioned, the transportation sector, if we were to design cities for people instead of for cars, we'd be much better off. And I think there's now a convergence of demand where baby boomers and millennials do not want to be commuting by car. There's this this desire to be in a walkable or bikeable area. So I think that there's a demand that's there. And I think that this area is one of the most important, fastest growing areas in public health is health in the built environment. Because of course, more and more people live in cities, and how we design our cities has an incredible impact on our health, both in promoting physical fitness, in green space for mental health, and green space for reducing the urban heat island effect. So a really important place to really have interventions is in the urban built environment.
And then Diana asks or makes a comment. The media is doing a terrible job speaking as a media person. Statistically, they rarely mention climate change with stories on California wildfires and Hurricane Ida, et cetera, et cetera. Terrible. It should be incessant and inescapable, but it is like they're trying not to offend. That's a comment. If you'd like to respond to the comment, that would be great.
Yeah. It is a problem, and there are some initiatives to try to overcome that. There's Climate Nexus. There's another one. I'm trying to remember it, where they're trying to counteract some of the disinformation, but also trying to get mention of the climate crisis and climate change in meteorology, in those reports. So there are efforts like that. There are new initiatives, of course, coming out of the Biden administration, and just announced on Monday is a new Office of Climate Change and Health Equity. So there's going to be a lot more going on regarding climate change as a health issue and looking at the equity issue. And so luckily, the current administration is cranking out more things about climate change, and they're, the infrastructure bill that is, the American Jobs Act, focuses on climate change to say, hey, this is the way of the future. Why, we want to invest in jobs in the future so that we're competitive with the rest of the world. So I think there's a lot going on, certainly with the new Biden administration. And hopefully there'll be more media that covers climate change. So we
Great.
just have to keep pushing, keep shouting.
Are there any other questions in the chat? I don't see any more. Would anybody like to chime in? If not, thank you very much, Jonathan. Again, my gratitude to you. My thanks to Pat for making this happen. I'm looking forward to having Christina Carlson's talk sometime in the near future at her convenience. Thanks to everybody that tuned in. If you were expecting to hear Christina Carlson's talk, I hope we get to hear that in the near future. And I hope you also found Jonathan's talk enlightening, illuminating, motivating.
Mm-hmm.
There's one more message here. Let's see what we got here. Jay Fleischer says thanks. And I think that's a good one there.
Yeah.
Hope to see everybody that can be here in person next week at the Discovery Building for the special presentation by Uwe Bergman, a new professor in physics, who's going to be talking about lasers. And in 2 weeks back here at the Biotechnology Center with a special celebration of the 10th anniversary of the IceCube Neutrino Observatory. We've got some great stuff coming up in the next 2 weeks here, plus we get to get back together. We'll also have Zooms and web streaming of some sort available. So if you can't come into campus, you're watching from anywhere else, we still want to keep you connected. And thank you again, Jonathan.
Pleasure.